What is going on, busy bariatrics? Let's talk about one of the most important skills nobody really teaches after bariatric surgery: self-regulation. Surgery is going to change your stomach. It does not automatically change your coping skills, emotional responses, stress patterns, or behaviors. And honestly, this is where a lot of people struggle long term. Before surgery, many people used food for regulation, whether they realized it or not. If they were stressed, they would eat. If they were bored, they would eat. Overwhelmed, they would eat. Lonely, they would eat. Celebrating, they would eat. Avoiding emotions, eat. Food often becomes comfort, stimulation, distraction, reward, numbness, and emotional management all rolled into one. Then surgery happens. And suddenly, the amount of food you can use changes dramatically. But the emotions themselves, they're still there. The stress still exists, the loneliness still exists, the anxiety still exists, and the boredom still exists. Which is why so many bariatric patients feel emotionally overwhelmed after surgery. The coping strategy changed before the emotional skills did. That's why self-regulation matters so much. Self-regulation is your ability to pause, identify what you're feeling, and respond intentionally instead of reacting impulsively. And that skill affects everything after bariatric surgery, whether it be nutrition, relationships, spending habits, alcohol use, transfer addiction, consistency, communication, emotional eating, grazing, and even your weekend spirals. Because if every uncomfortable emotion immediately turns into impulsive behavior, long-term success is going to become much harder. And let me be clear, self-regulation does not mean becoming emotionless. It means learning how to experience emotions without letting them drive the car. A lot of people think discipline means never struggling, and that's not true. Real discipline is learning how to tolerate discomfort without immediately escaping it. And honestly, that's really hard, especially if food was your primary coping mechanism for years or even decades. This is why awareness becomes so important after surgery. At Busy Bariatrics, we teach clients to start asking better questions before reacting automatically. Simple questions like, what am I actually feeling right now? Am I physically hungry or emotionally overwhelmed? What happened before the craving started? What need am I trying to meet? What would help me regulate instead of react? Because awareness actually is going to create choice, and choice is going to create change. One of the biggest things we work on is helping clients slow the gap between emotion and reaction. That pause matters. Sometimes somebody isn't actually craving food. They're craving relief. Relief from stress, overstimulation, loneliness, exhaustion. And if you ever learn alternative regulation skills, food often gets replaced by something else. It could be shopping, alcohol, gambling, scrolling, relationships, overworking, or constant stimulation. That's why behavior work matters so much after bariatric surgery. Now, self-regulation skills can look different for different people, and sometimes it could be something as simple as taking a walk, or journaling, or breathing exercises. You might call someone supportive. You might need to remove yourself from the environment. You might want to practice more structured routines throughout the day. You might even actually just want to do something as simple as getting to sleep or going to therapy. The more you learn mindfulness or use strength training consistently, or it could be something as simple as creating boundaries. And no, this isn't about becoming perfectly healed. Our goal is to build more awareness and improve your response patterns over time, because the goal is progress, not perfection. Another important piece here is nervous system regulation. Many people live in a constant state of stress activation. They're either always stimulated, or they're always rushing, or they're always feeling overwhelmed, or they're always reacting. And when your nervous system stays overloaded, impulsive behaviors become much harder to manage. That's why basics matter so much: your sleep, your hydration, your nutrition, your movement, and your structure. A dysregulated body is often going to create a dysregulated mind. And that's why all or nothing thinking becomes so dangerous after surgery. A lot of bariatric patients feel one uncomfortable emotion and immediately decide, I blew it, I failed, I'm back to old habits, I'll restart Monday. That spiral usually creates more dysregulation. That causes more guilt as well, more shame and more avoidance. At Busy Bariatrics, one of the biggest things we teach clients is that a difficult moment does not have to become a destructive pattern. One off meal plan is not failure. One stressful day is not failure. One emotional moment is not failure. The skill is learning how to recover faster instead of spiraling longer. That's where self regulation comes in. And honestly, this may be one of the most important long term skills after bariatric surgery because life does not stop being stressful after weight loss. Relationships are still going to happen, parenting still going to happen, work stress still happens, loss and anxiety are all going to still happen. The difference is learning how to navigate those experiences without using self destruction as the coping strategy. That's where your real transformation happens after weight loss surgery. Yes, the scale is part of the process, but learning how to stay present, intentional, and aligned, even when life gets difficult, that's the real win. And if you're trying to build healthier habits, emotional regulation skills, and long term consistency after bariatric surgery, that's exactly why we built Busy Bariatrics. So go ahead and follow us for a no BS approach to post op fitness and nutrition. And as always, keep getting busy.